Well, the health care law was all about lowering costs and getting the uninsured insured. But a new survey says a whopping 2/3 of those who don't have a health plan just yet may not buy one at all. And Steve, you say this is going to cost us all. Explain.
Well, if they don't get everyone into this thing, then obviously they're going to have more costs. And what they've designed it in a way is that younger people, even with subsidies, are paying more than they should in a normal free market. And so younger people, at least initially, are going to say, if they catch me, I'll pay the small fine and not have to pay $5,000 to $7,000. And if you go on these exchanges and do apples-to-apples comparison, California and Oregon, Kaiser Permanente plans, you find out that you're going to pay more on the exchanges than you do on the free market because the government puts in a lot of stuff that most people don't want.
Okay, Rick, what do you think?
I hardly know where to begin. For starters, it's not true what Steve just said. In fact, we know that the California exchange rates are coming in better than we expected, and that people under 25, where the mean income is $25,000 a year, which qualifies a large percentage of them for subsidies, are going to be paying less than they have to pay now.
All right, but overall, what are they, 30% more in the health exchanges versus now?
Here's the other part of this, though. This poll that came out that you're referring to saying that 65% don't know if they're going to sign up. You know what? I wish I had a nickel for every call I get from people. Hey, I'm turning 65 in a week. How does Medicare work? People haven't focused on this yet because the exchange don't open till October. Let's talk about this when that comes and people start thinking about it.
Well, it takes a long time to get, basically, it takes a long time to get qualified for coverage, if that's what I was about to say. Yes, it does. It takes more than a quarter, 3 months rather. John, what do you make of this?
Well, of course, costs are going up because this is not insurance. Insurance is historically cheap because you are buying something for the unthinkable. But politicians with Obamacare want us to have insurance, something to pay for every malady, and they also want it to be that we can show up and get insurance when we're already sick. Because this is not insurance, it's naturally going to be expensive. If you want cheap and health insurance, make an insurance again.
All right, Morgan, and here's the thing. I mean, didn't Kathleen Sebelius at Health and Human Services say, yes, premiums really going up? And I think Sabrina had pointed that out. And so did the CBO. What do you make of it?
Yeah, I mean, I think it's safe to say that premiums are going to go up for some people. How much and what that's going to look like, and for the people that it will go up, I think still a lot remains to be seen. Going back to Rick's point, the fact that these exchanges don't even open up for enrollment in October, I think there's a lot for Americans to focus on, and they are focusing on before they even start to look at this. We just had the jobs numbers out this week. We still have about 20% of young adults without jobs. I think they're looking to get those jobs before they even start to think about enrolling on exchanges. So I think it's still really premature. We also have the debt ceiling debate that's going to come up before this even takes place.
Right, but
I think it's still premature to figure out just how much those premiums will go up.
But here's the thing: the poll results show less than half of the people who responded. Less than half think they're going to get better health care, and about half think it's going to get more difficult to get tests. What do you make of the results there?
Well, I actually think that costs are going to come in less than expected, because anybody with any sense expected costs to triple, and instead they're only going to double.
You're only going to Sabrina,
what do you expect, Liz? Listen, this is what we've got. We've got a system where you're taking something that used to cost money and now it's going to be, quote, free.
I hear what you're saying.
Cost has to go up. It has to go up. The demand goes up.
Sabrina, go ahead.
Yeah, no, the big problem is that the government is mandating that people buy something that they don't need, and the minimum essential coverage is so high that we're in effect telling people that they all have to buy a 5-bedroom house when they may only need a 1-bedroom apartment.
What do you mean they don't need, that they may not need? Go ahead.
Well, if you're a young man who just graduated college, you don't need all of these bells and whistles. You don't need all sorts of coverage. They don't need to be covering me to have a baby. He probably has college loans and other debt that he may need to pay off, but instead he's subsidizing me.
Rick, go ahead.
How could you possibly know if you're going to get a cancer diagnosis next week? That's number one.
That's catastrophic coverage.
Number two,
it's important
to me. It's important that we clear something up here, because everybody thinks what John Tammy just said. It is absolutely untrue that you can get sick, then get insurance. There is an open enrollment period. It will start in October. It'll finish on March 31st of next year. If you don't buy the insurance, you can't buy it until the next enrollment period.
Well, that kind of stinks. Go ahead, Steve.
Yeah, it stinks. Otherwise, everybody would wait.
John has it right in the sense that this is not insurance at all. It's prepaying next year's expenses, hopefully. And as for a younger person, it's exactly true. You want catastrophic coverage. You don't need things for balding and things like that. So you choose. You should be able to choose what you want, not have the government impose it on you.
All right, guys, we got to leave it there. Next up, privacy concerns erupting over reports that the government is snooping just about everything. Phone calls, emails, credit cards, you name it. Should you fear it? The Cash and In crew is on it at the bottom of the hour. But up here next, after 3 months of protests, the TSA deep sixing its plan to allow small knives back on planes. That's not good enough for some at Forbes. They say we need to deep six the TSA. Are they right or are they wrong? That's up next. TSA not okay. The Transportation Security Administration backtracking on its plan to let small knives, baseball bats, and some other banned items back on airplanes. An idea that many airline employees and travelers said was very dangerous. And Sabrina, you say this is why airport security should be privatized. Explain.
Yeah, this is just one more example. I don't think anyone on the panel here today thinks that, asking moms to take their little booties off their babies or making me tearing over my manicure scissors is actually keeping us any safer. In fact, it's probably making us less safe by making things so systematized, so sort of regularized that terrorists or people who want to hurt Americans will know exactly how to navigate the system. So we absolutely need ways to make the system more efficient and to try out new screening techniques.
Okay, Rick, are some airports in this country privatized and it's working rather nicely, Rick Unger?
Yeah, the problem is the logic kind of fails here. Even if you were to privatize every airport, you would still have the government deciding if knives can go on a plane or not. You're not going to leave it to every security firm to decide, well, yeah, you can take them on in Detroit, but you can't take them on in Los Angeles. Now, what I don't understand is why they won't let you take golf clubs. I'm far more dangerous to the driver on the golf course if you're standing on the right when I slice than I am with them on an airplane.
Steve, but it's pretty scary for flight attendants and passengers to think that some lunatic could have a pocket knife, even any kind of knife or any kind of a weapon still brought on board. I mean, yes, the cockpit doors are strengthened, but what about the rest of the people in the plane, Steve?
Yeah, especially when you get a delay and tempers are rising up. You don't want anything in people's hands, not even a drink, maybe a drink.
Or a golf club in Rick Unger's hand.
Yeah. But the bottom line, you hit on earlier, Lizzie, is that privatized airports are immensely more efficient than those that aren't. San Francisco versus Los Angeles. San Francisco is about 50 to 70% more productive, even though they pay the same wages, go through the same training, and operate under ultimately the same agency. What this goes to is privatize. The TSA can set standards, as the FAA does, but then let companies figure out how to do it more efficiently and come up with innovations.
Yeah, John, it feels like more and more fly the unfriendly skies despite all the government's efforts. John Tamney, what do you think?
Well, that's why you privatize. If American doesn't protect its passengers, it goes out of business. If the TSA doesn't protect it, it gets more taxpayer money to expand its bureaucracy. The profit motive is the path to innovation. It means that airlines will compete to figure out the best and safest ways to get people through airports. Let the airlines compete here.
I mean, Israel's airlines do that, Morgan. What do you think?
I think Steve hit the nail on the head here. I think you keep the TSA minimally there to oversee and to set the regulations, and I think you bring private sector workers in to operate at the airports. And we're seeing more and more airports apply to have this scenario at their locations. Sarasota Bradenton was the latest one this week. Congressman John Mica, who is the granddaddy of TSA, he's proposing this as well.
Sabrina, what do you think?
No, I absolutely agree. I just think that ultimately we want to do what's going to keep Americans safe. And I think that unless we have that kind of marketplace where we can try different things out, then we're ultimately sort of setting ourselves up for a disaster.
John Tamney, you think we're setting ourselves up for a disaster?
Well, always, because you're asking the least qualified people to protect us, and that usually ends in a disastrous scenario. Bring it back to the markets.
Well, least qualified, what do you think, Rick?
It'd be the same people. They'd just be working for a private firm. And be a little bit careful with the comparison to El Al and Israel. Remember,
Rick.
they run far fewer flights than we do here in the United States. They can do things much differently.
Yeah, but a lot of people in Washington, D.C. were saying El Al does it great. Maybe we should pattern
They do a great job.
airports and airlines. Go ahead, Steve. Hang on, go ahead.
But we have it right here in our own country, in places like San Francisco and Los Angeles. So again, you can set standards on training and things like that. Let other companies figure out how to do it most efficiently.
All right, Morgan, go ahead. Final word.
And I think the big point here is that TSA carts in a lot of their employees, which is one of the reasons it is so much more expensive than private sector employees.
Interesting. All right, coming up, looking for a great gift for that high school